the occiput, and really there's different layers of muscles that do attach to the occiput. Semispinalis capitis, some of the suboccipital muscles. So we'll start on the occiput, and I'll come down to these suboccipital muscles in this area. So you should know the attachments of those muscles if you want to specifically palpate. But even then, they're pretty deep, so you're probably not going to be able to specifically get one of those muscles. So I'll just do it here on the left side since the majority of the class is over there. Do you want me to do it on this side? Okay, right here. So occiput, and I'm just in this posterior region, getting those suboccipital muscles. I can go down to the C1 and C2 transverse process. So who knows how to palpate the C1 transverse process? Where are we going to find that? Yep. So mastoid process, anterior and inferior. It doesn't seem like it, but that's where your transverse process is for C1. Okay? Right there. So I'll come here and I'll palpate it. One of the things that I'll do, another way that you could assess the upper cervical, the occiput on C1 flexion, is I get her right here and I just relax that head. Tilt up and back. When I do this, when I tilt forward, the chin tuck, I should feel those joints between the mastoid and that transverse process. I should feel some space so they separate. Just relax there. And then when I tilt back, I should feel them coming closer together. So that's another way you can assess the joint mobility. So there's C1, and then to get to C2, I know that's a little bit more posterior. And a little bit more distal, so coming over this way I can palpate that transverse process. Let's see, what else do we say? Lower cervical transverse processes, that's really those articular pillars. You can just go all the way down the side here. If you get too lateral, you'll get those transverse processes, and they're really tender. On even a person that doesn't have any pain, they're tender, so you don't want to get in here and really push real hard because it's painful. What muscles attached to it? The transverse processes? Your scalenes, okay. And then the articular pillars, where you want to palpate, if you get on that transverse process, you go a little bit posterior and a little bit medial, and that's where you can palpate those articular pillars. All the way up and down that cervical region for this group over here of 3 people. 4 to 3. Okay, so right now I'm on our articular pillars. If I come over here, I'm on her transverse process, and that's where it's pretty painful. All right, let's grow. Semispinalis capitis. If we come to the posterior part, a little bit lateral of the spinous process, come all the way up and down here. The most prominent muscle there is the semispinalis capitis. So really, if we're talking the spine, I'm just a little bit on either side of it. That's and it comes straight. It comes vertical here. Now, if I palpate a muscle that's tight and it feels like it's going from the mastoid process to the kind of the mid-cervical region in this direction, that's the semispinalis capitis. I'm sorry, that's the splenius capitis. So that's how you palpate that muscle. Over here, semispinalis capitis, and I'm just a little bit lateral to the spinous process, and did it again. Splenius capitis coming to the mastoid process. Okay, so it's in this direction, splenius capitis. The semispinalis capitis just going vertical. The upper trap, okay, is going to be over here on the side. So if we come and palpate the, what's that?
It feels good.
Feels good. The spine of the scapula, and we come around here to the more lateral portion. We can palpate that upper trap. On either side we could do that. What's the levator scapula attached to? Superior angle. So I'm coming posterior here. How's that? It's usually tight in most people. Okay. So on this side, upper trap, its attachments here, and it's going to come all the way up. So all of that is her upper trap. And the levator scapula on that superior angle of the scapula.
Why do you think she's at the spot?
Scalenes, well, first rib we know is going to be, we just worked on that, so we don't need to go too much into that. Sternocleidomastoid, hold your head right there. Okay, so just relax. Actually, her sternocleidomastoid's coming here from the sternum, going to the mastoid back here. So don't worry about the Clyde. So if we get in this area, this is going to be her scalene muscle right in here. On the other side, here's her sternocleidomastoid muscle coming here. Dig into this area, and that's her scalene, first rib, sternocleidomastoid, levator scapula, pec minor. So another area that may be tight is her pec minor. So we come over here and we find what's the pec minor attached to? Coracoid process, which anyone, again, that's another tender point. Doesn't matter who it is, it's usually tender. So we'll come off to the side, and we know it's going to attach to the sternal area, those ribs, those anterior ribs. So just come right here, and we could do some soft tissue there. You know, and obviously when you're in this area too, you want to make sure that, tell them what you're doing and make sure that they know what you're doing so that they're not surprised when you're in this area. I wouldn't go on the insertion of that muscle, but you just stay on the origin here. This is where it's tight, usually. Okay? Questions with that? And I think that's kind of a good